So, unfortunately, our children suffer in silence for extended periods of time because we have not really truly accepted the fact that something could be wrong and take the necessary steps to get that checked out. But with children today, you see a lot of ADHD, that's the attention
Oh,
deficit
yeah.
well, I can get into all what that means, but ADHD, you see a lot of behavioral concerns. And then with teenagers and young adolescents, we're seeing a lot of cutting and suicide attempts.
Mm-hmm.
And so there are warning signs for the most part, but sometimes children don't share everything. So even if you're not noticing the behavioral changes and they're not talking to you, you can sometimes get that out of the blue thing where people just kind of snap and they just cross over that line.
Yeah.
But typically, there are patterns with children who are going through something. They might withdraw. They might isolate themselves.
Absolutely.
They might start sleeping more
Mm-hmm.
or might start sleeping less. Changes in your diet, eating habits. All those things are things that we as adults go through with children as well, and those are definite signs that there's something going on.
I want to tell my audience that one of my sons, my older son, when he was a teenager and his father died, and after that, he just changed. He became withdrawn and all of that. So like you said, they're not going to tell their parents everything. So I could only go so far. I took him to counseling, and he said, "Mom, that was the best thing you ever did for me."
Wow.
Just so he could be able to share without me, or without my opinion, or without feeling judged, or whatever the kids feel about us. You know how it is with parents and kids. But
they don't want to disappoint. They don't want to disappoint.
And there's certain things you're not going to tell us. Simply as that. So he said that was the best thing you ever did for me, was give me somebody else to talk to. So parents, there's nothing wrong with that. Nothing wrong with that. Carolyn, so talk about, you have some services that you provide for mental health in the African American community. Talk about the services that your organization provides.
Okay. We had our inaugural mental health fair this year, and the Black psychiatrists of Greater Atlanta came out and did mental health screenings right there on site.
Mm-hmm.
We had a number of vendors who came and provided, information about the resources that they have for people who may have mental illnesses or family members who are taking care of loved ones with mental illnesses. And the general public came out just so they could learn. That's going to be an annual event. We are getting ready to coordinate our first annual high school mental health profession career day program, because according to NAMI, less than 2% of mental health professionals are Black. So we want to solve that problem by increasing the number of Black students going to college, majoring in the mental health profession.
Mm-hmm.
So we'll have Black college students coming to the high schools and Black mental health professionals coming and giving a description about the different types of, programs that they can major in. And then another one is You Are What You Eat. We're bringing in a group of nutritionists and dietitians to teach the general public about the types of foods to avoid. There are certain foods that can alter the chemicals in your brain and cause you to have a chemical imbalance. And then we have massages for you. It's been scientifically documented that touch therapy, massage therapy, increases serotonin and dopamine in the brain, which are two natural antidepressants. And the list goes on. We have a postpartum prevention initiative that we're going to be introducing.
Mm-hmm.
I've written about 30 programs, and I'm just so excited about doing all of them. I learned this year that I can have to focus on one and get that one up and running, and then focus on another one. I wanted to do all of them at the same time, and it didn't work.
Won't work that way, will it?
Yeah, I know. We did the mental health fair, and we got lots of supporting documentation, and so we're marketing it now to corporations and government agencies so we can be ready in May. But right now, we also have Let's Talk About It, which is a weekly open discussion that we have at our national headquarters in Stockbridge.
Mm-hmm.
Every week at 6 o'clock, people can come who have mental illnesses, or if they think they may, or they have loved ones that they're taking care of, or you just want to come to just talk about it. In January, Let's Talk About It will be on the road as well. We'll be at a different location each month.
Oh, that's good.
So that will be advertised on our website.
Mm-hmm.
And we have lots of programs, but people can go to our website and get a list of our programs. And the website is www.mhiaac.org. That's www.mhiaac.org. Or they could call me on my cell, 770-873-4496. That's 770-873-4496.
Talk about for a moment, either one of you ladies, but probably Nicole, if we think that we're having a problem or somebody in our family, where do we start? Would our general practitioner take care of that? Is that outside of that realm? How do we get to a practitioner, a therapist, a psychiatrist, a psychologist? What happens there?
Well, there definitely is a process. One of the great things about mental health in the African American community is that we have a provider network. So if you can't get to your primary care physician, or you don't know where to go as far as who to look for to best help your situation, you can definitely call us here. And we have a database that we can use to refer. As Carolyn said, we do screenings. We have a brief screening tool that we can use while we talk to you over the phone to kind of see what's going on and to get you to the best place. Now, this is in the situation where it's not a crisis and there's not an emergency. If you or your loved one is in crisis mode, meaning they're having thoughts of hurting themselves, hurting somebody else, they've already tried or whatever, in those instances, you want to immediately call 911 or get them to an emergency room. But if you're at the point where you're questioning something's going on, I'm not quite sure, I know something's happening with my loved one, I need to get some help, you can reach out to your primary care physician. And again, that's depending upon your insurance, because sometimes you may have to do that first to get a referral out to a behavioral health specialist. In other situations, you can contact directly a behavioral health person and go that way. Just briefly, if I can give everyone a kind of brief overview of what that looks like. There are 3 different practitioners basically for mental health. You have a counselor or a therapist. That's someone who does therapy. We talk to you and help you process what's going on and get you to a place where you're feeling better, and we provide resources for that. You have a psychologist. That's someone who does testing. If there's some evaluations that need to be done to find out what's truly kind of going on inside, emotionally, mentally, cognitive, that's that person who takes care of that piece. And then there's a psychiatrist. That's a medical doctor who works with mental illness and prescribes medication. So a lot of people, when we say, you need to go get some help and talk to somebody, they instantly say, I don't need any medication. And they get really defensive. Medication is not for everyone. That's a resource that's available. But those are the 3 main practitioners that help deal with mental illnesses and mental health concerns. And if your listeners have any questions about that, again, they can call, the Impact office, or they can definitely reach out to me, and I can assist them in whatever way I can as well. But in the case of an emergency, call 911 or get to the emergency.
Absolutely. Mental health in the African American community. I Googled it and it just popped up. So if you've missed out or you can't remember what the web address is, just Google mental health in the African American community and it will come up. Carolyn, you want to give that information, the website, phone number one more time?
Sure. The website is www.mhiaac.org. That's www.mhiaac.org. And please call me on my cell phone. I keep it with me at all times. 770-873-4496. 770-873-4496. And you can also look us up on Facebook and YouTube and all of that.
All right. Fantastic. Ladies, thank you so much for joining us. Nicole Jackson, board chair elect, and I'm sure your plate is already full for next year. Also, Carolyn McKenzie, founder and president of Mental Health in the African American Community. Thank you so much for joining us.
Thank you so much.